Let us start then. Good morning, everyone. It's a pleasure to welcome all of you to the webinar on the role of South Asian civil society in the times of COVID-19 pandemic. My name is Kaustubh Bandyopadhyay, and I am the director of PRIA International Academy. I'm also a member of the steering committee of the Asia Democracy Network. As you know, this webinar is being jointly organized by PRIA International Academy and Asia Democracy Network. Asia Democracy Network is relatively a young network comprising of the defenders of democracy and human rights in the Asian countries. Its secretariat operates from Seoul and Bangkok, and we have two representatives from the secretariat today, Ichal Supriyadi and Sue. Sue is based in Seoul, and Ichal is based in Bangkok, but now he's stuck in his native place, Jakarta. Um, PRIA International Academy is based in New Delhi, and it offers capacity building opportunities through online and face-to-face courses to the development professionals. It undertakes research on contemporary issues and also offers advisory services. Colleagues, the global pandemic, COVID-19, and the subsequent lockdown has created widespread distress and destruction of our lives. However, the poor, marginalized, and informals are disproportionately affected. And amidst this chaos and disruption, we also see many states have taken steps to consolidate its power and showing authoritarian tendencies, and it might have an impact on our democratic way of life. It is in this backdrop today's webinar will discuss the following questions. Um, we have already circulated these questions, but for all of us, let me read this again. First questions that we are asking ourselves, what role civil society has been playing during the pandemic, and what role it should be playing in the coming years. The second question that we are asking, what challenges civil society face in playing these roles, and what support civil society in the region will need to meet these challenges. The third question that we are asking involving other stakeholders, and what role government, donors, and philanthropic foundations can play to enable civil society effectiveness. We have an excellent panel today. Many of them are founder leaders, thinkers, practitioners from the civil society across this region, and I will introduce them one by one as we move forward. Today, we are going to structure our discussion in two rounds, covering a set of South Asian countries in each round. What we have thought that in round one, we'll hear from Nepal, Bangladesh, and Sri Lanka. Unfortunately, our colleague from Maldives could not join us today. And in the second round, we'll hear from Bhutan, Afghanistan, Pakistan, and India. After each round, we'll have space for comments and questions. Just a few words on the Zoom platform, particularly for the attendees. You can watch these, you can listen to the conversation. When there will be a question hour time, then you can unmute yourself and raise your hand, and we can allow you to ask the questions to a panelist. It's not necessarily to ask the questions, but you can also add your comments and suggestions in the discussion. But if you have a particular questions to a particular panelist, please also mention them. That's it on the Zoom platform. Before we start, let me start with a poll questions. So here is the first question in front of you, and the question is that what support your organization is providing to the affected communities, and you can have a multiple choice. There are different options. You can vote for more than one answers. Take a minute, and including the panelists and the attendees, all of you can participate in this poll. Okay. We have got almost like 56 out of 87, 57. Good enough. Let's end the poll and let's see the results. So about 56% responded saying that they are involved in distribution of food, medicine, personal hygiene material, personal protective equipments. About 66% has mentioned that they are disseminating information related to pandemic. 46% have mentioned that disseminating information related to government schemes and programs. About 38% um, has responded that they are facilitating access to government schemes, and 49% said that collecting information from the community and share with the government. So a overwhelming role here, we can see the dissemination of information related to pandemic. That's the maximum percentage. Let's do the second poll. This question asks, what challenges your organization is facing in working with the pandemic affected communities? Again, you can choose more than one answers. And if you look at the answers, lack of authentic information, lack of mobility of staff due to lockdown, lack of material and funds, lack of organizational capacity to respond to demands, lack of support from the government. So let me end the poll now and see the result. Oh, so the overwhelming majority, that is 73%, said that lack of mobility of staff due to lockdown. That's the greatest challenge. Followed by lack of materials and funds, 62%, and lack of authentic information, 32%. And almost like 1/3 has mentioned that lack of support from the government. So that's the trend. Let's look at the third question. What kind of activities would your organization like to undertake with the affected communities in the next 2 to 3 years? Again, you can go for multiple choice. So let me end the poll and share the result. 73% have said promotion of livelihood options and building skills of the community. That's the priority in the next 2-3 years. Also generating awareness and enabling access to government schemes and advocacy and engagement with the government, which is about 70%. So let's keep these poll results in mind when we speak about what civil society has been doing and what civil society will be doing in the coming months and years. So let us start the first round of discussion, which involved speakers from Nepal, Bangladesh, and Sri Lanka. We have 3 speakers in this round. Ms. Shaheen Anam, who is the Executive Director of Manusher Jonno Foundation based in Bangladesh. We have Dr. Vinaya Aryaratne, who is the President of Sarvodaya Shramdan Movement Sri Lanka, and Mr. Jitram Lama, President, NGO Federation of Nepal. We have 3 commenters in this round. Mr. Aziz Rafi, Director of Afghan Civil Society Forum, but I couldn't see Aziz join this webinar. We'll wait for him. We have definitely Dr. Mitra Timsina, who is with the People's SARC and South Asia Alliance for Poverty Eradication. And we have John Samuel, Convener, Asia Democracy Network. I don't know whether John has also joined this discussion. So let me start with Shaheen. Shaheen,
yes.
You can start.
Thank you very much. Please let me know when I run out of time, okay? Because I just cannot. Good morning, everyone. I'm absolutely delighted to meet old friends and meet new friends, make new friends. Since time is very short, I'm going to be brief. Manusher Jonno Foundation is an organization in Bangladesh, and we support civil society organizations with capacity building and funding support to work on human rights and good governance. It's a it's a national organization all over Bangladesh, and we have we work with 150 partners all over Bangladesh, and in all out of 60 we work in 56 districts. Now to refer to your first question, the role of civil society, what role it has been playing, it is very much like what you saw in the polls and the background paper you gave. It was mostly directed at providing awareness on health and hygiene, and providing things like soap and others and all that, and also with food, which was extremely important right in the beginning. So that is the role that civil society has been playing alongside with government. So the government relief effort is very much being coordinated and helped by civil society organizations in Bangladesh, especially at local levels. But what role it should be playing, I would really like to emphasize that the role that civil society already plays of the watchdog role in ensuring now more than ever the transparency and accountability of the relief efforts, because there are issues of mistargeting, there are issues of leakage, and when there is a constraint of resources, it is more than important or now that all resources are used to the best of its capability. So that is the role that MGF partners and other civil society organizations have been playing. And in many places at local level, government has taken help from civil society in terms of targeting especially the most marginalized sections of society, where it's very, very easy to leave them behind. So these are women-headed households, these are old people, persons with disability, transgenders, sex workers. So I just want to say that Manusher Jonno Foundation targets the most marginalized sections of society, and these are some of the people that we already target. Now, if I come to what challenges civil society is facing, as it came out in the poll, that this whole lockdown is constricting the mobility, of course. So there's a lot of work that we are doing on the phone, from the phone, trying to make people aware where big mobilization is very difficult. Fund is also a great constraint for people to work with. So I would like again to come back to what role civil society should play. I think what is happening is there's a huge chance of inequality being exacerbated by this. So civil societies should really look at this whole issue of leave no one behind, and how we can ensure that the most vulnerable sections of society are not pushed further down the poverty line. As we all know, that reports are that the gains that all our countries have made in poverty reduction is going to go back 20 years, at least that is the prediction in Bangladesh. Not only poverty reduction, but all the social gains that we have made in terms of women's empowerment, in terms of education, in terms of health, all that has a chance of going back. So what can we do to make that impact maybe a little less for the poor sections of the society? And we should be very much focused on that. From Bangladesh context, there are 3 sectors which is extremely important for our economy. One is the migrant workers who send remittance to Bangladesh. One is the garment industry, which is really facing a huge challenge, and of course the last one is the workers in the informal sectors, who have been hit very hard by the continued lockdown. So if we look at these three sectors, it's a very, very, I think, dismal picture, because as you know, the migrant workers are being forced to come back. They're coming back with no jobs, no savings. They are in a very bad state. The garment industry, there are stimulus packages, but they're not being able to cope, and there's huge, huge issues of workers being losing their job. And of course, as we all know, what's happening in the informal sector. uh, the civil society has to increase its monitoring role, as I said in the beginning. And as we all know that globally, the pandemic has resulted in issues of domestic violence. Women are, as usual, whenever there is a pandemic or a man-made disaster or natural disaster, women and children end up bearing the greater burden of the impact. So the same is the case now, that women are facing a lot of domestic violence. Children are facing abuse. There's a huge chance that more and more children will be forced to go to work because of lack of because of the resource constraints in the family. There is a fear that early marriage, the gains that we had made in stopping early marriage, that might go back. Health of people, health of women and children especially, will now again be constrained. So there's a whole lot of issues that the civil society organizations have to get involved with. But I think that there are so many issues, but I think if we put it under one umbrella, I would say that the watchdog role, the monitoring role of civil society organizations to ensure transparency and accountability of government stimulus package or all the relief that they are giving should be on target, to make sure that it is on target, and also to make sure that the civil society efforts are coordinated and that we are not working in cross purposes. We have to avoid duplication. We have to go on, with the mapping of things. We have to undertake research and surveys. Manushya Jonno Foundation did a quick survey through telephone to look at issues of violence against women, and we are seeing a very, very, horrific picture emerging. So considering all that, the response should be very targeted, very coordinated. Of course, we have to work with government to ensure that, as I said, the stimulus package is used properly, but also our work that civil society is doing in terms of providing relief, in terms of providing all the support, should be coordinated. And finally, I would say that there's another issue, which is to address stigmatization. A lot of people are facing stigmatization, especially the returnee migrants who are accused of spreading this. So we need to look at those issues. So I think the issues of human rights is extremely important for us to consider. I think I've come to the end of my time.
Thank you, Shaheen.
Yes,
Thank you.
I'll just
Thank
take,
you,
finally, I would say that there are some efforts, regional efforts to address this COVID response, and there are organizations such as Bees, and I think Vinay can talk a little bit about it, and we should look at those efforts, that the national response and the regional response can also be coordinated. Thank you.
Thank you so much. Let me now invite Dr. Vinaya Aryaratne from Sri Lanka.
Thank you, Kostau. Thank you for giving this opportunity. Because Shaheen has already mentioned about the work that they have been doing, which is very similar to what we have been doing. I will touch on some of the points that were a little bit unique to Sri Lanka. But I would like to start by first telling you something about the context in which we are facing the epidemic here in Sri Lanka. Being an island nation, Sri Lanka had been able to take steps to contain the spread of the epidemic at an early stage, and also the measures such as quarantine that followed, and also the lockdown, extended curfews and so on, helped us to contain from a public health point of view, the spread of the virus. And also, we are still, like many other countries in South Asia, in stage 3, that is cluster transmission, and it hasn't still gone into community transmission. So we are able to locate the clusters which have the spread of infection, and then even when the restrictions were lifted, there could be certain public health measures that could be taken to contain the disease. So still the numbers are relatively small with only 9 deaths. So compared to some other countries, our healthcare system has not been stretched that much. And also I must remind that Sri Lanka is unique in that sense, because we have had a robust public health system, universally free public healthcare system, which was in place and which had evolved over the years due to the state policy of free health and healthcare delivery. Therefore, the system was able to up to now manage without really being stretched out like in other countries. Now, when you come to the role of civil society, of course, we share the similar experience with our other civil society colleagues in the region, and we were responding as humanitarian organizations, meeting the urgent needs of the affected communities. So we were also particularly focused on daily wage earners, particularly in the Colombo city, who were provided with food and other supplies. However, one of the most important initiatives that we were involved as Sarvodaya has been in risk communication very early in the epidemic. We know, as it was mentioned earlier, one of the constraints for us as grassroots organizations is that because of the threat of infection itself on our own volunteers and workers, we could not move like during other disasters that we have faced, natural disasters or tsunami or any such disaster in the past. So we were able to really embark on risk communication through our network, through our own workers network, through our village societies that we were connected to, and that was able to reach quite a large population, and particularly in high risk areas as well. And then of course, use of social media. We have a very strong social media presence, and we were able to further disseminate this information coming from the government education sources as well. Then also we were involved in the national effort, mainly through the United Nations system, which has a humanitarian country team, and we are an active national partner, and Sarvodaya is co-leading the health cluster with the Ministry of Health and the WHO. However, I must stress the fact that civil society has not been actively involved at a policy level. None of the official bodies that have been created have civil society response. Even for that matter, even the private sector is not that well represented. So it's not an inclusive approach when it comes to decision making, and leaving aside, of course, the community voice is not heard in any of the initiatives that have been planned and conducted. Understandably, probably in the initial stages that was required, but we see now, as we are in a transition now to a more long-term recovery process, while the threat of the infection hasn't disappeared, then it's a very challenging situation. However, even though we were not involved in a big way in the decision making process or at the national level as equal partners with the state, there was a request made from the civil society to help look after the institutional care homes around the country. So we have about 850 care homes around the country, children's homes, elders homes, homes for disabled. And so we were able to actually form a civil society platform of more than 20-30 organizations, both working at national level and also at community level, at district level. So we were able to respond to that request, reaching more than 850 care homes, more than 15,000 residents of these homes, because particularly the elders' homes need to be protected, because if the infection gets to elders homes, of course, it's going to be a very sad story. So coming to the second part of your question, how we respond as civil society, but we need to also look at the context that has evolved even before the COVID-19 challenge came before us. So we all know that we have been working on societal change, addressing the basic needs of people while trying to affect a structural change in economic and social systems. So what we are experiencing today is really trying to respond to pre-COVID injustices that have been there in our societies, and also the shrinking civil space shrinking civil society space has been a problem, a challenge, and also the current political and governance system, which is using very narrowly the ethnic and religious divides in the country, are very, very challenging, and those got much more surfaced and acute during the time of our response. Then the government's own administrative systems have been bypassed in the name of efficiency and to deliver essential services. So there is a lack of inclusion even within the government system. So the whole of government approach is not there. Even when you talk about the whole of society, that is also a challenging situation. So how do we respond as civil society for the future? I think we have to reflect on ourselves as well, our own organizations, the mandates, and what we have been doing in the past, right? Because this threat is so severe, so acute, it infects not only the human body, but it has infected all systems in our societies. So how do you heal those systems? So we have to think of alternative economic systems, alternative social systems. So some of the work that organization like Sarvodaya, which has existed for 60 years, we were always advocating for devolved structures, devolved governance, Gram Swaraj concept. And we need to now, it was very clear that if we had a devolved system of governance, and there are good examples from India, from Kerala, how the panchayat system really effectively addressed some of the crisis situations in those parts of the country, we need to come up with a devolved model of governance and the civil society, how we can use technology, how we can respond to the capacity building needs of communities. Finally, I think it's also important that we develop new leadership. There has to be new leaders who are equipped to face the new challenges. COVID is not going to go away. There are other waves of infections that are going to come. So we have to live with a very threatening world in terms of health, public health, as well as on other matters. So
okay,
if
thank you, Vinay. Vinaya, thank you. I think we can come back to you during the question and answer session and the comment section.
Thank you.
You have raised many important points, particularly that how do you respond to a crisis situation when there are existing inequalities. And what is worrying is also the lack of presence of civil society at the policy arena. And therefore, the new leadership, there is a need for new leadership to come up and which in a way, resonates with what Shaheen has said, that the monitoring role, the watchdog functions of the civil society. Let me now invite Jitram from Nepal. Yes.
Thank you so much.
Yeah.
I am Jitram Lama from NGO Federation of Nepal. NGO Federation of Nepal, you all know that it is a national umbrella organization. We have more than 65,000 members across the country. We work very closely with government of Nepal, other development partners, civil society organization, and other network and federation. Thank you. First of all, thank you very much for organizing such type of webinar to emphasize the role of civil society organization during the time of Corona in South Asia level. First of all, I would like to present some statistics of Nepalese context. In Nepal, up to date, confirmed case is 487, recovered case 49, deaths 3, people in isolation 435, people in quarantine 25,030. And countrywide lockdown came into effect on 24 March and it continued to end on 2nd June 2020. And also I also assessed the government response to COVID-19. Mostly effective in timely declaration and enforcement of lockdown and social distancing measures. High-level committee for COVID-19 control and response coordinated by Deputy Prime Minister, and government established relief fund and mobilized in one window system. Government of Nepal prepared some policy document and guidelines to mobilize stakeholders on COVID-19 control and response. Major procedures and guidelines are working procedures on human rights monitoring network in context of COVID-19, COVID-19 fund utilization guideline, quarantine operation and management guideline, relief distribution guideline, and volunteer mobilization guideline. And government of Nepal prepared and endorsed the plan of action to mobilize civil society organization in order to improve and address the effect of COVID-19 on women, children, senior citizens, people with disabilities, and most vulnerable communities. These all preparing phase of this all guideline and procedures, Nepalese civil society organization providing policy feedback to integrate COVID-19 response and recovery action plan. And now we are preparing guideline to mobilize and coordinate civil society organization in Nepal. Definitely, it helps to mobilize civil society organization on COVID control and response plan and to prepare long-term, medium-term, and existing plan and policy. Major role and our contribution of civil society organization, now I'm going to present. After the case of COVID-19 occurred and the containment measures against COVID-19 started in Nepal, NFN and all civil society organizations come together and have taken numbers of actions and initiatives despite significant challenges in prevention of COVID-19. We are being engaged and taking most urgent action on situation assessment, support government in tracking COVID-19 cases, support in preparing and applying a response plan, and monitoring to ongoing action on relief provision to most vulnerable population and communities despite of government lockdown. Nepalese civil society organization engaged for awareness raising. We already discussed on awareness raising. Role of a civil society organization is awareness raising, advocacy and lobby on COVID-19, immediate response, support, food, transportation, medical equipment, personal hygiene and personal protective materials, and volunteer mobilization across the countries. These all are doing by Nepalese civil society with leadership of local government. And we developed and disseminated a poster for public awareness on COVID-19 and made a call for action, mainly encouraging everyone for social distancing, sanitation, arranging work from home, following only the authentic news and information. And also we issued joint statement along with all Nepalese civil society organization, federation, in which we called upon the government and everyone concerned to protect the lives of poorest and most vulnerable people, and provide relief and necessary support to needy people, well management of quarantine and isolation center, maintain transparency and accountability in all the actions against COVID-19, to make adequate provisional to identification, testing, and isolation and treatment. And most important thing is to adhere the fundamental rights of citizens. Besides this, NFN and all Nepalese civil society organizations conducted meeting with international partners, development partners, international NGOs, government of Nepal to respond and utilization of existing resources to fight against COVID-19 and support to government and vulnerable community. We organized number of people's dialogue against the COVID-19 on the possible roles of civil society organization in working together with government in responding to COVID-19 and its possible threats on human health, economic and environmental challenges, and promote equitable, dignified and accountable partnership. And also we lobby and we have conducted meeting and face-to-face online Zoom meeting with government agencies, mainly National Planning Commission, Ministry of Women, Children, Women and Senior Citizens, Social Welfare Council, province government, local government, and other stakeholders to develop better partnership and better understanding to fight against the COVID. And also the most exemplary work we have done in Nepal is NFN initiated to form a high-level monitoring mechanism across the country. We formed this mechanism in high level, national level, province level, and local level, led by National Human Rights Commission, Nepal Bar Association, Federation of Nepali Journalists, and Federation of Nepalese CSOs, NGO Federation of Nepal. This network monitoring the activities carried out by government of Nepal in relation to COVID-19, right to life, treatment, availability of medical equipment, livelihood problem of marginal people, consumers' rights, right to access to justice, freedom of expression and freedom of association, role of civil society organization, and situation of all other human rights conditions affected by COVID-19 and lockdown. These all are our TOR, and we have established all 7 provinces information center and monitoring mechanism committee, and also district level, all 77 districts we formed this monitoring mechanism and also information center. We collect information and to suggest government and other stakeholders how to tackle this problem, how to tackle this human rights violation system. And we are also coordinating and with national and international CSO network and alliances. Beside this, our local civil society organizations support needy people to distribute food and relief materials, medicine and personal hygiene, personal protective materials to most of vulnerable community, especially focused on women, senior citizens, children, poor, landless, wage labor, and other vulnerable communities, peoples under the leadership of local government. Also, government established one government relief fund, and Nepalese civil society organization also contribute to the government relief fund. Over 100,000 USD support to the government relief fund. This is also the exemplary work.
Good.
The pandemic of COVID-19 is very challenging for whole community. Being Nepal is least developed country, Nepal doesn't have that much human resources, financial resources, health services intact to respond to this crisis. Even though we work very hard and fight against COVID. Even CSOs also don't have that much resources that allocated to response COVID because it is a new disaster. It is not planned disaster. Even though Nepal government decided to transfer 20% regular development budget to transfer the COVID control and response plan and address the COVID effect. Nepalese civil society can develop their plan and action to control, response, and to mitigate the COVID-19 pandemic. It is very challenging and established norms for social distancing, taking immediate steps to follow other health measures and provide relief materials during the lockdown period. It is difficult to mobility of our staffs due to staffs and to work closely with communities and to continue to deliver the program commitment that was already designed.
Thank you.
Another important thing is other challenges.
Jitram, if you could conclude in a minute.
At last, we express our solidarity and commitment to doing our part to prevent the spread of COVID-19 in line with international, regional, national, and local level. Thus, cooperation and coordination is urgently needed to economic front too. Given the nature of our economy and supply chain, we have to support government for clear country action plan of action and implement it as faster as possible with transparent way. That's why we is joint plan and action is needed for future. Thank you very much.
Thank you. Thank you so much. Yeah. Let us now open up for a couple of questions. I can see one hand raised. The participants now can raise your hands so that I know that who you are and you can ask your question. So let me first invite Dr. Amit.
Yes,
Amit.
Amit Trishula. Yeah, good morning to all the panelists. My question is that the situation in India is very grave as the attack on human rights defenders and journalists are increasing. Because of their action of exposing the government's inactions or failure to deal with the situation arose from COVID-19 and consequent lockdown. So I would like to know how does the Indian leading civil society organizations are responding to this reprisal on HRD and journalists?
Thanks. Susrita Roy.
Hello, I am Sushrita. I am a PhD student at Jawaharlal Nehru University. I am interested in understanding how do you think the civil society, which is not the NGO kind of civil society, but the civil society in terms of panchayat institutions, can better be involved, can be best involved in COVID management, given that a lot of exodus has now taken place from the urban to the rural area. So there needs to be much more, attention and involvement of theirs. So I think I need our experiences from probably Sri Lanka and Bangladesh, where there is a significant rural population. Anybody, any of the panelists can kind of respond. Thank you.
Okay. We have a couple of questions also written on the Q&A section. Before I invite Netra Prasad Thimsina, let me read out a couple of these questions. One question was that many of you have talked about the coordinated action by the civil society. And if we link this with the coordinated effort to monitor the government's effort, that might require a unified framework. Do we have that unified framework in place at this moment? So that's one question. Second question was, what can be done for the migrant workers? This particular question was directed to Shaheen, but I think that is more general questions to and relevant to all the countries. A specific question was that what could be the role of civil society organizations in preventing domestic violence, particularly during the time of pandemic. So these are questions. I suggest that you keep these questions in mind. Let me now invite Netra. Netra, when you reflect on what you have heard from the panelists, and if you could also address a couple of these questions, any thoughts that you might have vis-a-vis this question. Shaheen, would you like to answer these questions with regard to
Yes, please.
What can be done for the migrant workers?
Yes, thank you. The problem that migrant workers are facing are manifold. First of all, the migrant workers who have been working in Europe and in the Middle East, many of them came back during this time. And they are being blamed for bringing in the infection because it was very, very mishandled when they landed in Bangladesh. There was no proper testing done, and they were just told, oh, go home and observe isolation. So they were all sent home, and there was no facility for quarantining them properly. So they went home, and then there was a lot of spread of infection, as we know, as in other places in the region. And then the other problem is that thousands of them are losing jobs. And I'm talking about foreign migrant workers. I'm not talking about the internal migrants, the issue that India has. So thousands of them are losing jobs and they are being forced to come back. Now, how we are addressing those is we are lobbying with government to take care of the migrants workers who have been taking care of our economy. You know, they send $10 billion a year, more than $10 billion in remittance to Bangladesh. So Bangladesh economy has really indebted to these people. Now that they are in trouble, we are lobbying very strongly with government to take care of them. There is a very large migrant welfare fund, which we are asking the government to use to provide them with relief in terms of food and livelihood and all that. But from civil society organizations, we are doing messages all over Bangladesh to stop this stigmatization and to take care of these migrant workers who are really in a very bad shape, from their families, from their community, and from everybody else. So that is our response to the situation of the migrant. We are lobbying with government and forcing government to talk to the receiving countries to not to force them to come back, but to let them, give them salary and let them stay. And then also lobbying so that in the receiving countries, our high commissions also take care of them.
Thank you, Shaheen. Mitra, can you talk now? Where is Mitra? Mitra's line is lost. Vinaya, Dr. Vinaya, there was a question for you that is there any concerted effort or network effort in Sri Lanka with the civil society?
Yes, currently there is none, but the only platform that is there for the civil society organizations is to connect with the United Nations Humanitarian Country Team cluster system, where the national civil society organizations are also members, and they coordinate in the key sectors: food, health, education, risk communication, community engagement, and so on. It's an early stage still. So we hope that that's a platform that can be developed, but there is no civil society collective at the moment beyond what I have already described in meeting the needs of institutional care homes. In the next phase, we think we really need that, and we are working on it. At the moment, it's evolving. Then may I also take the opportunity just to quickly respond to that other question about devolved governance and engagement with community organizations. I think that's very, very important. Maybe that is the way forward in a situation where mobility is going to be restricted, to get the community organizations take more responsibility, and we are working on that. How we can still conduct, taking all public health precautions, some capacity building for community-based organizations, CBOs, and we have a network. Sarvodaya has a network around the country. We have already selected the areas where which were badly affected and picked up community-based organizations, not just those connected to Sarvodaya, but also to other organizations. And we are trying to formalize that network, have technology platform to connect all these, and have interactions and address the socio-economic recovery process. Thank you.
Thank you. Thank you. Let's take one more questions from Daya Sagar Srishta. Dayaji, you can ask your question.
Kastubji, can you hear me?
Yes, we can hear you there.
Okay, I do not take a long time. Just want to highlight the situation of Nepal. Actually, what we see that actually the role of the government is reactive rather than proactive, so that the people really, who are poor, they are suffering nowadays. And regarding the role of civil society organization, actually the legal environment, the policy environment is not comfortable for the civil society organization at the moment. In Nepal, non-governmental organizations, they are heavily dependent on international NGOs or international organizations. So the fund constraint is the major challenge for civil society organization at this condition, and the government rule is also not comfortable for now. So the civil society organization, non-governmental organization are not able to directly work at the community level. They have to depend on the local governments at this moment. And the mobility restriction is another challenge there for civil society organization. And another challenge is that civil society's role, civil society's existence is not properly, adequately recognized in Nepal. Only, actually the civil society organizations are also not able to collectively work in our country. But the role of media is very effective nowadays to, to monitor the situation and to make the awareness to the people. This is the situation of Nepal. Okay, these are some points from my side. Thank you.
Thank you, Daddy. Yeah. Netra, can you speak now?
Okay, thank you, Disconnect. Sorry, I will finish in 2 minutes. Just what I see is that the panelists deliberated this pandemic, the health pandemic has brought is not remains as a health crisis only, but it entered into the economic and social crisis. And then it has a very unique nature, and so and it has been a kind of the what is called outcome of the whole neoliberal paradigm, and then whole the capitalistic mode of the development paradigm, and it has completely failed. Kind of the symptoms that has come up with the society. And then in this context, I see what I found is that from the deliberation, the civil society organization is also in the critical stage. It is not in the way we were before. So it has two major role to play. The one is the role that they have been playing now, the volunteering, okay, providing supports to the needy people, all kind of the supports, material supports and social psychological support, and then awareness campaign. What has been going through all these 8 South Asian countries, how the panel is presented. And then simultaneously, another role the civil society we have is that the panel is presented is that the watchdog. Watchdog means that we have the role as a pressure group, whether the state and government at different levels, they are accountable, they are transparent. And then also I found that from the deliberation that they have been monitoring the human rights issues, and then all the monitoring of the government action functions. So this is two roles primarily in the South Asian countries. The civil society now has been playing. The final things I would like to also came some presentation, but it is also my opinion that how I see the future strategy. We should also the crisis is in the crossroad. It has not completely failed the world system. The whole capitalist mode of the development paradigm, it has not been at what is called completely collapse. It is in a crossroad. So we have a role to engage in the post-COVID development paradigm, because there must be some alternative that states and even the existing system will be looking for. And then how our civil society as a regional level, at a country level, at a global level, we can play a critical role for alternative development that we wanted to back. Looking at the millions and millions people are in the crisis, and they are not going back again to their normal business, normal life. So we have already been in the crisis of the livelihood crisis of the billions of people. So in future, we should not only doing the watchdog as a civil society, as a critical civil society, as presented one of the students from the JNU, that how we link the local, regional and global to influence the alternative paradigm that we wanted to be in our country, in our region. Thank you, Kaustav.
Thank you, Netraji. Let's move to the next section of our discussion. And in this section, we'll have speakers from Bhutan, Pakistan, India. I don't know whether our colleagues from Afghanistan would be able to join. We'll wait for them. But let me start with Ms. Tashi Pem. Ms. Tashi Pem is the country director, Helvetia Swiss Intercooperation in Bhutan. Tashi?
Yes.
Yeah,
Hello.
you can speak now.
Yes. So thank you very much for having me on this very interesting panel. And I also would like to join Kostov in welcoming all the other participants as well, who have shown an interest in this topic. So I'll start with your first question, the role that civil society has been playing during this pandemic and what it should be playing beyond this. So as earlier speakers have also mentioned, I think spreading information, education, awareness, doing very critical prevention work, identifying and reaching out to the most at-risk and vulnerable groups of individuals and families, communities. And what has particularly been inspiring in my part of the world is civil society volunteerism. I think that has been very inspirational to see. We have seen teachers coming forward to ensure that learning is not disrupted. We have seen young people ensuring that social distancing takes place in the vegetable market, for example. We have seen farmers come forward contributing rice and vegetables to people in quarantine. We have seen private sector donating at a magnitude never seen before, at least in Bhutan. So all these have been civil society volunteerism at its best. That was very inspirational to see. This pandemic has also been a source of innovation, online service provision, e-governance, education going online through social apps, TV-based learning. These have been sped up. There's a lot of momentum built around this. Now, beyond the pandemic, what civil society could do more perhaps is to link these actions we are doing today to meet immediate relief and immediate health and survival needs, to link these to more medium-term, longer-term perspectives. I feel that civil society could do more to build on this current momentum, to talk about things like social protection for people in the private sector, to talk more about water programs, to talk more about what we could do better in our rebuilding programs, what we could do better to ensure that development is more equitable. Because what this pandemic has brought a very strong spotlight on is the inequalities in the South Asia region. So, these are topics where I feel we could do more beyond the pandemic. Now, challenges that civil society face in playing these roles is, I think civil society organizations may be seen to be less relevant. I think globally the relevance of civil society organizations are more and more being questioned. And during times like this, when central agencies take charge of the overall response towards COVID-19, CSOs risk being seen to be even less relevant and of use. And regaining this sense of lost relevance or space after the pandemic may be difficult. So this could possibly be a challenge. There is also reduced civil society participation for practical reasons. I mean, village meetings, local government assemblies cannot happen since all of us are under some form of lockdown or restricted movements. This makes civil society work and participation difficult. Another trend I'm seeing is that there are a lot of funding windows that have opened. And these funding windows are short-term, and they rely on very quick expending of resources for relief-based activities. The risk is that at the moment we see a big surge of funds coming in for a short window of time, after which it looks like these funding sources will reduce or even dry up. So that is also a challenge that CSOs are facing and will face. Now in Bhutan, we see that the government has called on civil society organizations to play a complementary role in reaching out to the unreached, in reaching out to remote communities, women, persons with disabilities, and so forth. I think this is a very good initiative of the government. This is to be applauded. But at the same time, rising up to the occasion, when you're called on to complement and supplement the government's efforts, rising up to the occasion needs coalition building, needs good networks, need organization capacity, which does not come easily, we realize, to some of us. Now, what support civil society will need to meet these challenges? I will combine the response to this second part of your second question with also the third question. I think donors, foundations, partners of civil society need to amplify and strengthen the response that CSOs are initiating. We see a lot of small civil society initiatives and actions taking place, which may never gain momentum if donors and foundations and government do not put their weight and their funds behind relevant and innovative initiatives of civil society. I think that this is what donors need to do more. Donors, foundations, governments also need to continue to engage civil society during this pandemic. If nothing else, it will help to emphasize the value of civil society generally. For example, connecting civil society actors to donor-funded pandemic support packages would be very crucial, so that civil society is not sidelined at this time and then fall into oblivion in the future. I think making use of civil society structures and networks, making use of local government structures and reach, making use of all this civil society volunteerism spirit that has come up, leveraging upon this would be very important, I feel. And also, as countries begin to formulate recovery programs, there is a big chance that we would go for short-term economic recovery programs at all cost. And we completely understand the rationale and the urgency to do so. But at the same time, I think it falls on donors, on foundations, on civil society to encourage, remind, even impose on states to be conscious of equity goals, to be conscious of environmental climate change goals, to be conscious of gender goals, governance goals when we are formulating recovering packages. There are also practical, immediate recommendations, considerations that donors and foundations could make. For example, flexibility in assistance they're providing, for example, allowing repurposing, even reinvention of programs at this time.
Thank you, Tashi. Let me now invite Ms. Sadika Salahuddin. Sadika is the Executive Director at Indus Resource Center based in Pakistan.
Okay, I was saying that I was enjoying all the presentations because there was a lot of similarities with what we are doing and how the situation is in Pakistan. But there are some very specific things which are good learning material for us. Now, I'll take the first part of the first question and then I'll come back to the second part at the end. Now, civil society organizations had been very active, I think, in this century after the millennium. In this millennium, we had two major crises or natural disasters. One was in 2005, which was the major earthquake, and the other one was 2010-11 floods. And I think this civil society, as we call them, the human rights defenders and the development actors, they learned these skills and they learned the rules of the game of handling disasters in the earthquake of 2005. They not only that they learned some of the skills, but they also learned how to scale up their activities. Before that, the organizations were quite small. So, they did a wonderful job at that time. In 2010-11, in major floods, I think they were very active. But now in this third disaster, or pandemic as we call it, the situation. Hello. The situation is a bit different. The situation is the civil society scenario has changed in Pakistan. The civil society, somebody was also talking about the shrinking space of civil society. So the shrinking space of civil society is very, very obvious. But in the name of civil society, and of course part of the civil society, some mega actors, major actors have entered, and they are either retired bureaucrats or they are overseas Pakistanis who are coming back to Pakistan, and they want to contribute to the development of the country, or to enter into solving some of the problems, but they are working at a very big scale. And like Indus Hospital, like Salani Welfare Organization, like Foundation. Sorry? Yeah, so that is the situation. So, you know, the point is that they are doing good work. They are doing good service delivery work. Number two, they are focusing on skills enhancement of the unemployed, but there is no empowerment agenda as such. There is no agenda for human rights in their working now, and they enjoy the trust of religious leaders, and that is why they are raising money from the country. They are not going and this is what people appreciate, that they are not dependent on foreign donors. They're taking money from inside the country, and it's all zakat and sadaqat money which they are getting. So they are the ones who are big players these days in this pandemic. Apart from that, the regular civil society had been engaged in the work that some people have talked about, that in Pakistan we had a long debate on this, and we still have that saving lives is important, or compensating for the loss of livelihood is important. So lives versus livelihood debate is going on. But and even the governments have this kind of a division whether they should go for, if you are for if you are pro lockdown, it means that you are more interested in saving lives. If you are talking about easing the lockdown, it means that you are pro livelihood, you know. But the challenge, of course, is to take both together and see how they can help each other. So, civil society organizations had been engaged basically in distribution of food ration, because that was the immediate need in after the lockdown in Pakistan. And but other than that, they are also improving physical infrastructures of isolation camps and quarantine camps, providing wash services, improving water and sanitation, and supplying prepared food and all that stuff. So they are doing immediate things, and they are doing the health related things. PPEs was a big crisis in the beginning, and I think it was all over the world that people realized that there were not enough protection, personal protection equipment, and that has because of that we lost some very precious lives also. But that was the crisis. So the organizations, the civil society organizations, worked hard for in helping in that also. As far as challenges are concerned, I would like to talk about them. You know, if the crisis says that there is no, I mean, some people have no access to food at all, then, you know, how to distribute food to them. And all these mega players, as I was talking about, they came with huge amounts of rations, and I mean, it was very, very impressive the way they divided all that and distributed all that. But the problem, the biggest challenge was that there was no database. The database was only of some destitute women who were living on zakat, but the database for the new entrants into the poverty network, that was missing at all. There was no database of informal sector in Pakistan, like who are the people who are skilled or unskilled daily wage workers? Who are the people who are working with the small entrepreneurs and the small entrepreneurs who do not give any kind of social security or safety net? So that they were the or rickshaw drivers, so these were the people who are the newcomers to the poverty network, and there was no database of them. So the government grant could not reach to them. The philanthropists were working to help them, but they are also coming from a different class, and they did not know what is happening inside the slums of Karachi or slums of Lahore. So, for them entering into those areas and looking at the right people, that was a big challenge. And then there were other challenges related to that they could reach to those who could come and see them. But what about women-headed households? What about elderly people? What about disabled? So, they were left behind. So that was a big, database is a big challenge that we don't have. We have the ID card NADRA system, the ID card system, a very good system, but that does not talk about my profession or my source of livelihood or anything. It's just my name and my address and other details. So the other challenge was that the civil societies like our organization and your organization, their major strength is communication with the grassroots people. Here, the nature of the pandemic was such that communication was not possible, that physical, it could be only through telephones or other things because of the risk of life. So, that became a very big challenge, that how to convey the messages without really seeing them. And then there are a lot of, I don't know about India, but in Pakistan, there were a lot of myths around this pandemic. Somebody talked about stigmatization. That is very much there also. Now, in the myths are that some people have totally ignored the existence of, they are still ignoring the existence. They think it's some Western kind of a conspiracy. There is nothing like corona or something, and they think that it is defying the preventive measures. That is some kind of a bravery, that they don't wear masks or they don't follow the social distancing and all that. So, those are big challenges. And another challenge which is very close to, when a child grows, you teach the child some kind of manners, and all those manners are not allowed in social distancing. You can't shake hands, you can't hug. Now Eid is coming, and Eid, you know that people hug each other. I don't know what we will do on this Eid. So, just de-learning all what children have learned throughout their lives, or people have learned throughout, that is a big challenge. Then there is...
Shadika, can you sort of, conclude it in a minute?
Okay, I will. Okay, now I'll come to this, what the civil society should be doing. Now, we have talked about unbearable inequalities that have revealed. We have talked about fragile public health system that has come out. We have talked about the data issues. I think these things make very good advocacy agenda for civil society organizations. Once the life becomes to new normal, they can go. For direct relief, I think civil society can continue for direct relief because they can reach to the unreachables, unlike others. Then they can also look at the research agenda, and I think for an organization like PRIA, there is a lot of research agenda in this, that what about labor laws? Do they apply to all these people or not? How to provide them safety nets? How to take social security and all those things? Then the livelihood loss of women, I think nobody's talking about them. There are domestic servants, there are home-based workers, there are beauticians, there are school teachers in neighborhood schools not being paid well. All these women have have lost their jobs or had deductions. So this research agenda, and then what comes out from the research, that can also become that is for civil society. And then facilitating linkages with government programs. I think civil society had been good in dissemination of information and also facilitating linkages. And one thing I would like to say, that this can enrich, update, and enhance social mobilization package with Corona learning for civil society. And civil society is also talking about maybe old-fashioned things for a long time, and now there is a need to renew that. As far as support is concerned, in Pakistan, that's entirely a different subject, but it is an important subject, that there is a relationship of mistrust in a way. Civil society is passing through a difficult time. From 2015, this all started. So I think that trust relationship needs to be renewed, and unless because you need MOUs, you need NOCs for doing everything. And as far as donors are concerned, I think they should invest in sustainable development, and they should not give up human rights agenda, because what we see sometimes, that they are also in service delivery and they have compromised the human rights agenda. You can't have democracy without human rights agenda. And for civil society, I would say that the government should try to ease the lockdown of regularities that we have. There are so many regulations that we are supposed to meet. So
thank you, Sadika. It was wonderful. You have highlighted a number of roles for civil society organizations, including its research role, its linkage building role, and social mobilization in a different way. It can't continue with the same way of social mobilization in the era of pandemic. Let me now invite Jagdaji, as we call him, Mr. Jagdanand, who is the founder, mentor of Center for Youth and Social Development, based in Bhubaneswar, India. Jagdaji.
Thank you, Kaustav and the PRIA, for this wonderful opportunity to really bring all of us in South Asia together. Let me join also Shaheen, Binay, and Tashi, Shadika, Jitram, who have articulated what I wanted to articulate. So the problem is the same. And the solutions are maybe little different, but we have to really work on a solution. So let me, divide my presentation into three parts in this very short time. First is, what is the situation right now? What are we doing? And what is the future actually? The situation, as I see, this is an epidemic. This is not a disaster alone. It's a disaster plus epidemic. This is the first time a biological disaster of this kind and size and shape has happened in India and elsewhere around the world. But in India, we have a law which came up in 2005, that is the National Disaster Management Act, which really defines the roles of various bodies, roles of the government at different levels, the federal government, local government, etc. So this is the first time a biological disaster is, we are facing it. This is the time which is looking like an emergency situation, where the powerful government has taken over. The mighty power of the state is visible now. No democratic space, no feedback, very little feedback, I would say. Third is restrictions on movements and larger gatherings. There is no demonstration taking place. So completely, a different situation. But at the same time, a new situation which has come in India, as well as elsewhere now, I hear from Shaheen and others, the issue of distressed migrants. I'm talking of distressed migrants, not just migrants. People who have gone, they're on daily wage work, and after a week, they don't have any money actually to survive. So large-scale distressed migrants are walking on the national highways and roads And their number is not a small number. 50, 60 million of them are walking on the street by bicycle, 1,000 kilometers, 500 kilometers, 700 kilometers. It's a new situation. The whole country is observing. The mighty power of the state is also first time confronting a situation of this kind and size and shape. The new mantra, the lockdown, the shutdown, the containment is now the new normal actually, along with our mute and unmute. So in a situation like this, I see also there are abrupt and frequent changes in policies and programs which reduces the stability of us. So now, if this is the scenario backdrop, what are we doing? How are we responding actually? You see, we are now responding by providing people facing unprecedented disruption in their lives, through food, shelter, and livelihood support wherever it's possible. In Odisha, where I come from, the Eastern India, we have set up a citizen action group, which is sitting on a daily basis, 4:30 in the afternoon. We have to meet together, devise the feedback from the ground, and provide a kind of recommendatory note to the government every week, actually. And that is really working. I think many of our suggestions, recommendations, they're working without acknowledging us, of course, but they're going seamlessly from our side to all that people who are in the decision making. In my organization, CYST is reaching the excluded communities who are outside the public distribution system, national food security system, national social security system. We have almost reached about 8,000 families, but that number is, much more than that. We are running a citizen support center, which is a virtual citizen support center, which is running with empathy and sensitivity combined with psychosocial counseling for anyone who needs that, including information dissemination and this. Then we are also running, a support program to the quarantine centers or the temporary medical centers to run it in a more, like a camp situation in which there is a full program from morning to evening. And thereby we are assisting the local governments to run those quarantine centers. Of course, like all of you, we are also doing entitlement monitoring and support. Last but not the least, we are also involved in a technology work by doing some drone-based disinfection, public awareness program. So there are drones, and today we are running a drone training program to create local capacities of drone pilots and drone systems so that they can go around. And last, influencing the national and local policies. We had a very powerful interaction with, some of us, not all of us, right, with the high power committee set up by the government of India, and which includes the Prime Minister's office, the Cabinet Secretariat, the Health Ministry, separate meeting with the Health Ministry and the Minister. And then, that is all happening through a little window which we have at the Niti Aayog, which was the erstwhile Planning Commission, which was handling the kind of, relationship between the government and civil society. Now, this is the kind of work which we are doing. What is the future, actually? That is my last play. I'm visualizing a different scenario, actually. A scenario where we have to reimagine a new rural India and a new rural Asia, actually. And why I'm doing it? Because the rural areas in India, maybe in 1-2 years, are in the middle of a renaissance with an expanding economic and cultural life. Skilled migrant workers, they choose to remain in their villages. They are more connected than ever before through the digital media now, because millions of them who are walking on the foot to come back to their homeland with no money, with no food, with no water. They have tested the big cities, which are not very attractive for them. They have faced the high level of discrimination compared to her, esteem in their respective villages. Very strong negative experience they have faced outside. So I don't think they are going to go back And so therefore, what I see now, and that, thereby the priorities and needs of our target group or the people with and the communities with whom we are working are likely to change actually in the post-COVID scenario. Digitization is going to reach every corner of the private and public life, as we have seen. The voiceless, whom we consider as people with whom we work, they are also going to be digitally connected, virtually organized, phone to support migrants, and other things which are happening now. Traditional development work is affected now. New corona has new normals. Because I see now, this problem is not going to disappear during the next 2 months or by end of May actually. This is going to stay with us. So therefore, I see the Sendai framework of action has to be redefined now. From preparedness, prevention and mitigation, what does it mean for a biological disaster of this kind? We have to redefine the relation of civil society with the local governments, where we ensure and work together like true partners in livelihood security. As as we hear my friend from Sri Lanka, Aryaratne, Gram Swaraj, the true Gram Swaraj, the sustainable agriculture debate is going to come back. Water security and all related issues are going to come back. The decentralized governance is a big agenda now, which has to be, looked at. The basic services has to be redefined. The health is going to be virtual health care now. Because when doctors, patients, and the hospitals, in India, we have exposed the kind of the other side of the public health system, the primary health care system. So therefore, the virtual health care I see as a big possibility actually. The education with Zoom, Google Hangout, etc. The other dimension which I see very clearly is a reskilling of the rural workforce. That is going to be a major chunk in our livelihood restoration program. And in India, we have this right to work, Mahatma Gandhi National Rural Employment Guarantee Program, which has already, been on now to provide at least 100 days of work, guaranteed work to the rural people. Some places it was working, some places it was not working. Now the state is giving a call to the civil society to come forward, help the local governments to really activate the Mahatma Gandhi National Rural Employment Guarantee Program. The forest-dependent poor who depends on the non-timber forest producers, right? There is a new range of minimum support price which has been rolled out now. I think that is something very important, and then we have to also, play our cards there to ensure that the minimum support price is guaranteed to our tribal brothers and sisters. So therefore, lastly, let me tell you, innovation is going to be the major driver of this new change process in the post-COVID. And civil society organizations need to occupy this new space. We have to really reoccupy this new space, which is going to come. With these words, let me thank Kaustav and the team for this wonderful facilitation. Thank you.
Thank you. Thank you so much, Jagdaji. So let us now open for some questions from the participants. Aparna, you can talk.
Hello, yes, I'm Aparna Pathak from Sri Adhar Kendra. We have worked in local level, state level in Maharashtra. My concern here is we came across women from red light area, the tribal community. I could see inequality. So my concern was how to bring them in the system, the main course to help them out. And one more concern was the immunity of all the women, because now we see the immunity is the main concern to fight any pandemic like corona. So what are the suggestions from panel members? Give us some guidelines. Thank you.
Okay, thank you. Well, you can also see a number of questions and comments have been made on the Q&A section, and some are related to regional cooperation between civil society groups. Some are specific to one or the other specific constituency. Susrita?
Hello, can you hear me, sir?
Yes, we can hear you.
I wanted to ask, my question is to Jagda sir, that do you think NGOs across India now needs to do a coalition, a networking, something of the sort that you are talking about at state level, to learn from each other? You know, we should now start learning. We have a big range of experience, so how can we teach each other, or how can we, how can we build each other's capacity to not to invent the wheel again and again, but to learn and make things faster, make changes faster. Thank you.
Hear from Mr. Harsh Jetli, who is the Chief Executive Officer of Voluntary Action Network India. Harshji?
Thank you, Kaustav. First of all, I would like to thank you especially about that survey which you did before. I think that survey highlighted so many things which we all wanted to share and discuss about it. And thanks, Jagdaji, about your new normal. That new normal is comfortable as well as scary. Why I'm saying scary? Because, what government is now observing and experiencing is what they always wanted to have from us. We are heavily into providing services, maybe at the time of crisis, because that's what we see is the most useful, most important thing to be done, and we are doing it, providing health services, providing food, because there is a crisis at the door itself. And also, they also wanted always that the CSRs and foundations give them money. I'm giving example that how this PM Care in India has wiped out all the funding of CSOs for future, and also from foundation. So actually we are in a situation where we all are, the situation has put us in the reality where we are doing what they wanted us to do always. As many of the participants also said, that there is no space for analysis. Again, if you do any critical question, again, there is no space for that. But the reality is that, yes, as Costa rightly said, the space is shrinking. It has been shrinking. It's not a recent phenomena, and it's not a local phenomena. It's a global phenomena. It has been going on for almost 1 or 2 decades. Now, when the crisis comes, our colleague from Pakistan said that there was a natural disaster in Pakistan, and also India also faced many natural disasters in the last few years. Whenever there is a natural disaster, because we are at the field level, because we are at the grassroots, we face that issue immediately. And that's why, the reaction is to support the population, the community with whom we work. Now, this situation, if you see what happens, that in these financial regulations which have been created all over, wanted CSO can't have any money in their, as a savings. Neither FCRA money, not Indian money, not foreign money. But when the crisis came, every CSO, every grassroots organization, every national organization put in, whatever they had in their hands to provide services to the people who wanted immediately. So that was the immediate response from all of us to serve those community. But on the other hand, if you see, those shrinking spaces also restricted the operational space of CSOs to provide those services. Yeah, the Costa's survey nearly said when 73% of the respondents said that yes, in the time of lockdown, they are harassed by local police. They wanted local passes from them. We were not considered as essential services. In many states, CSOs were ready to provide services to the people, but they were not allowed to do that. So I would like to say that, sir, it was for all of you, I'm saying, sir and madam, that at least in our country, it is a whole process which is designed by bureaucrats and implemented by police, at least in the beginning. The second issue is about the resources. Yes, I said initially, we have been facing resource crunch in this country because foreign funding has withered away. We had little scope of getting money from CSRs and philanthropists. But a few days back in my conversation with Dr. Rajesh Kendall, we were discussing that how PMO is acting like a fundraiser and calling corporate sector and even the public sector companies to fund money to PM Care. And they have wiped out all the money. So what is the future? No one knows. What type of resources we are going to get? No one knows. And interestingly, yeah. And interestingly, there have been, and I fear, and I think there is a one study also from the bond, and it's also a research question. which I think Priya should pitch in near future, that how the organizations are going to survive in future. Because now, since it is it is a desired and expected role we are playing vis-a-vis government, but what will happen post COVID? Will they go back to their square one, and then there will be no resources? How many organizations will have this crisis? Please, also I would like to remind everyone that during this period, when this whole, just before COVID, they came out with the CSR, corporate social responsibility rules amendment, in which they said no society, no trust will get CSR money, only Section 8 companies will get. They came out with the income tax financial bill amendment, where they say every organization which takes tax benefits has to go renewal for 5 years. So these things are also going on simultaneously. And the mistrust is so much, actually. When Jagdaji was saying about this high power committee, and in high power committee, Jagdaji is member of that. Niti Aayog wrote letters to those who were registered under Darpan, around 95,000 organizations. Since additional secretary of FCRA was also there, he also wrote letter to FCRA holding organization. FCRA, for the international listeners, FCRA is the law which regulates the foreign funding in India. So he also wrote letters to those who registered with him. There were around some of them. Now, when everyone received that letter, that mistrust is so much that people got scared. We started getting phone calls at what to do. Then we said it is an optional thing. It is not a compulsory thing. Don't do it. Don't get scared. So that is, I think, is what I'm trying to say is the current situation in which, if you see, we are getting almost 6,000 cases per day. Earlier in our newspaper, that was headlines, but now that is not headline. The headline is something else now. So I think the new normal which is coming is also very scary. And but I think there's a future role. If you see, I will agree with the speakers, but I will add 1 or 2 points into that. First is that whenever there is a pandemic or such crisis, globally or nationally or locally, the socio-economic and political structures are shaken up, and many people say that they, like in our country, those things are being exposed now. I give you one example, which I am suffering, because see, in India they created national capital region area, in which they promoted that people who can live in one place and work in another place, which is under 2 different states. And I live in a place which is coming under Haryana government, and my office is in Delhi. Offices are open in both the states, but we can't go because the border is sealed by both other states. So these are the operational, things which are already there in the system, and many such things are coming up in the grassroots level also. That how, while implementing the relief and services, how those structures which are weakened are coming up. So I think these things are giving us opportunity for the future also, because in future, if you see, we have to work that the new normal which comes after this COVID is much better friendly, because some people are saying it is shaking capitalism also. So what is a new model we want? That is very important. The second issue is the narrative. One of the question which was raised, that how we can share the experiences. And I must say that once this whole crisis started in India, we thought that as a national platform to document the challenges and innovations and the work done by organizations starting from grassroots to national level, so that there is some documentation and people share their experiences vertically and horizontally and learn from each other. We got very good response out of that, and we realized one thing, that see, the thing is, people are working in this difficult situation. Now the time is to document our experiences so that we can do advocacy based on those work. And I'm thankful to PRIA team and especially Dr. Rajesh Kendall that we are working on a report on those experiences, that how we can use this document to change the narrative of the sector. The negative narrative worldwide is promoted by the ruling elite, saying that sector is like this, civil society sector is like this, they are problem creators, they are against GDP. So that is one of the issue, I think, opportunity we have. The last point is about the global institutions are also getting exposed, whether it's a WHO, WTO, or even EU at the time of Spain and all those crises. So these institutions will also come under question in near future. So I think it's a good opportunity as a civil society that we can work now to reflect on, to think on, to act on what type of institutions we need at various levels. And that's all I want to say. Thank you, Pastor.
Thank you so much, Harsh. Thank you. I could see that Mr. Zakir from Afghanistan has finally been able to join us. So let me before I go to Tahseen, let me invite Mr. Muhammad Zakir Stanikzai, who is the Executive Director of Afghanistan Institute of Civil Society. Mr. Zakir?
Good morning, good noon, and good afternoon to all of you.
Yeah, thank you for joining us. And if you could sort of briefly tell us, what is the situation in Afghanistan? We have heard, reflections from Nepal, Bangladesh, Bhutan, Pakistan, India, and other South Asian countries, but we are missing Afghanistan. So it will be wonderful to hear from you very briefly. Mr. Zakir.
Yes. First of all, Mr. Kastiv, thank you very much for organizing such a relevant and a very on-time webinar, and it will be very helpful for all of us. This pandemic have impacted a lot, of course, all of us, but particularly the poor and marginalized communities in Afghanistan, and even the civil society functions as sector in the country. In Afghanistan, we have still problems in terms of security in some of the regions where it is difficult to access and to provide these services to the community. In Afghanistan, we have a huge civil society in numbers. We have NGOs, we have membership-based organizations, we have community-based organizations, which is in every village. They play a very strong role in development and emergency both. They are dependent mostly to these donor communities resources, but some of them, they are also partnered with the government to implement some national level projects and all these. But we also have some few private sector support or philanthropic support to these civil society organizations. Civil society organizations, they play a critical role during this pandemic. Particularly, they are distributing food items, personal protection equipments to these communities at risk. And in the meantime, they raise awareness of those people in the villages and the districts about the effect of COVID-19 and how can they prevent themselves during this pandemic. Some of these national NGOs in Afghanistan, they partnered with the government of Afghanistan to deliver some basic health services in the villages and the districts. They does this, and also civil society in Afghanistan, they monitor government functions to make sure that the government health services, hospitals, they have proper equipment and they provide that proper services to the communities. They does all these. I think, to my understanding, at this context, they have to still continue providing this the same services and job in Afghanistan. But on the other hand, because to my understanding, in Afghanistan, majority of the support goes to the national capitals, big cities, rather than to these localities. Civil society can play a very strong to create a national solidarity among these community-based organizations, local leaders, local media, to make sure that we have active actors to fight this COVID-19 and make sure that we have services for those marginalized and people at risk. They can also continue, and they are continuing this advocacy on behalf of the peoples at risk. I told you that government, big NGOs, they focus on provincial capitals and cities. They don't know what is going on in the localities, particularly areas that are under the coverage of Taliban, particularly in the areas that are frontline for both parties, like government of Afghanistan in the Taliban. So they don't know much what is going on. I think the CSOs, it's a very right time to still continue advocating on behalf of those people at risk. As I told you, that civil society organizations, they play a very strong role, but on the other hand, they have some challenges. Security is deteriorating. Like some of these NGOs, they have access to those areas under the control of Taliban, but majority of them, they cannot even go to those areas. And yesterday, unfortunately, I have even heard that some Talibans in some provinces, they ordered their soldiers to kill corona patients. So these type of confusions are going on, and CSOs cannot go there. And I think it's the government and the Taliban's job to create this platform for CSOs to go there. They should understand that this is for the benefit of themselves as well. So this is one challenge. Another challenge is the funding for civil society in Afghanistan. You know that majority of civil society organizations, they are dependent to this donors funding. The recent report that is developed and released by the USAID, society is changed, and even the way of delivering services. So that's a major problem for civil society organizations, and I think it's the government of Afghanistan and also the donors and private sector to support civil society organizations in terms of funding. Lack of coordination is another issue. Because there's this type of pandemic and disasters, there should be a proper coordination among the actors, particularly the Ministry of Public Health here in Afghanistan. They are moving up and down, but they do not have a clear mechanism, concrete mechanism through which they can coordinate with other actors, particularly NGOs that have been working with the health sector and fighting particularly COVID-19. They might have some mechanisms in the capital level, but I'm sure they have a very weak coordination on the provincial level and district level. That is very much important for the government, and we as civil society organizations are always shouting on them and trying to tell them that you should understand that the role of CSOs are critical and you have to help them and create this platform. In terms of donors and government role in even private sector, I think they can play a very strong role at this stage. First of all, I told you that funding is an issue because majority of these donors, they shifted. So to my understanding, it's not necessarily to only support those CSOs with health-centric programs. Even if an NGO is not working directly for health, but even if it is an economic activity that's still supporting those people at risk. So they should understand, and donors should, of course, focus on health and COVID health emergency, but in the meantime, they should also not forget the NGOs that are working for income generation and economic activities and so on. Private sector can play a very strong role, particularly these philanthropic foundations. Although if I compare in terms of number and percentage, we cannot compare the corporate social responsibility in private sector that are functioning and supporting CSOs are very much less, but at least they are there and they have to focus on supporting a system rather than providing this private giving and to those affected because they do not have that reach and they do not have that access to those marginalized communities. It's civil society that they have a route to those localities and they can easily shift this relief to those peoples at risk. Coordination is still an issue and the government should focus on this, and this is what I will raise it. Tomorrow there is a huge platform where I can raise this issue with the government that they have to coordinate it with the actors, but also with the civil society organizations in the provincial level.
Thank you, Mr. Jackie.
So these were my points, and if you have any question, I'm here to
sure. Thank you.
Give
Thank
you
you so
more
much,
information.
Mr. Okay. Thank you so much. Let me go to Tahsin, Mohammed Tahsin, who is the Executive Director of South Asia Partnership, Pakistan.
Hi, everybody. Can you hear me?
Yes, Tahsin, please go ahead.
So good to see all of you, new and old friends, and thank you, Priya. Thank you, Kaustav. I won't take much of a time. I have another meeting, unfortunately. Again, this new technology has created a different kind of stress, but there are two intriguing questions. One, this interesting dog, the stuffed dog you have, Kaustav, with you. It's it's really frustrating. I mean, it looks so good, and you feel like looking at him rather than you. So what is that dog doing here? Secondly,
I'm using my daughter's room.
Okay. Harsh, where is Anil Prakash? How did you get rid of him? Let me know, because I want to also leave SEP Pakistan and trying to find another one. Because earlier it was Anil who was heading Wani, no?
Yes,
Yeah.
yes. Anil Singh, long back. Yeah, long back.
Okay, quickly. Let me say a few words, not as Pakistani, but I'll try to be more South Asian. My first reaction is that I'm grateful to all of you, and Sadka Appa has very beautifully explained the situation in Pakistan, so I won't go what's happening in Pakistan. But my first question is, then when all of us as South Asians, when would we come out of our state given rules and regulations, and what can we do challenging all these and work as South Asian? What stops me setting up a little table in one of the main markets of Pakistan and raise funds for the epidemic in Calcutta or in Sri Lanka? I mean, why can't some Indians in Amritsar raise funds for the Pakistanis communities when it comes to epidemics or these kinds of problems? I mean, I think we need to go beyond. That is one question. My two observations. All of us have, in different words, have agreed that the existing model, it has failed miserably, and especially it has failed the poorest section of the society. I mean, you name them migrant workers, you name them, women working, home-based workers, or women working in the factories, you name whatever. But it is very, very clear now that this existing economic model has failed. Therefore, there needs to be a major policy shift in the region. All governments need to be, coerced. I would say we need to go to these governments and tell them enough of this model. There are other ways to deal with the situation, which in fact is pro-poor and which in fact is pro-workers. Another important is, I think it also requires a cultural shift. Why are we, living like, I mean, the school life, having I have my mobile working, but suddenly there's a new model, so I throw my working mobile and find a new one. Why? I mean, it's not cool anymore. Remember good old days, we will not do these kinds of things. So there has to be a total, I think, policy as well as cultural shift in our own working standards. Let me quickly tell you what has happened, something good in Pakistan. The government of Sindh has passed an ordinance, and the governor signed it 4 days back, where the definition of worker has encompassed everyone who's a worker, whether a home-based worker or a factory worker. And this ordinance says that they cannot be laid off. They cannot be kicked out of the job. And if at all they are kicked out of the job, the government as well as the employer will pay for their services, will pay their monthly whatever they were drawing. That's a huge step forward, and we are trying to take this ordinance as a precedent to the Punjab and other two provinces. So see, these kind of a work which can be taken in the whole South Asia, where the worker is respected. We have quickly done a quick research. I mean, now I think questions, and I would like to share what we have done in 44 districts as South Asia Partnership Pakistan and some other friends. And I mean, how have we collected data of working women, be the factory women or the home-based workers or the teachers or the women working in the fields. I mean, eye-opener. I mean, frankly, I mean, I had never realized, I mean, though working in the field for the last 30 years or so, but the kind of helplessness, the kind of poverty they are witnessing, and that's another major issue we are facing. When my personal thing, and please don't take me wrong, but I know I'm going to be very unpopular, that we, the organizations, civil society organizations, in the region, and especially in Pakistan, most of us are simply watching and praying that something good will happen. I mean, we are not a major actor at the moment against this all COVID-19. We are just small actors doing little things there, whereas all of us put together, we have such a huge constituency. We have reached to those villages where government have not reached to in all over South Asia. We have friends in every district of South Asia, whereas unfortunately, we are just not prepared to deal with the situation. And therefore, there are major questions in terms of future. That here is the situation where in most of the countries, if not all of South Asia, you cannot move an inch without the permission of the government. I know Sadiqa wanted to talk about this whole issue of shrinking spaces, that in Pakistan, you cannot move an inch without getting the permission, and not only from the government of Pakistan, but from the intelligence agencies, which is the most unintelligent agencies we have in this country. You know, how can you go there? You have to have NOCs, etc., etc. So without permission, you can't do. This is what the future is. Again, the whole devolution, we have been, beating our chest by saying devolution. Had there been a local governments, effective local governments in the region, I tell you, poor must not have suffered so much. Since ages, we are saying that the people should get employment where they are born. That there wouldn't have been a problem for migrant workers who are traveling for 3 nights without their shoes in India or in Pakistan. I mean, there's a sad situation. What I'm trying to say is that, our colleague from Dhaka was saying migrant workers from abroad. Yes, they are important, but let's not forget that Dhaka houses the largest number of people who have come and settled in Dhaka from outside cities of Dhaka. I think all of us and all CSOs put together, we at the moment are reaching maximum up to the 5% of these people, and we can go on and on. I'll finish here. That we, of course, this is the time that we need to go back to, which we earlier used to say. What is happening with people living in the forests? What is happening with fisher folk? What is happening with people whose lands have been sort of occupied by the corporate sector? All over South Asia, this model is there. A large number of people, I mean, epidemic, yes, or endemic, yes, it is important and we need to face, and whatever little we can do, we must do that. But we must raise fundamental questions. And the fundamental question is that until we start to live, we learn to live in peace in the region, until we know where should we spend our national budgets instead of buying arms and ammunition, we should have better health systems and better laws to govern the lives of poor people, especially in the working class, which is the largest in South Asia. With, I don't need to get into the politicians. And I'm repeating, until we have very robust health system, we have very robust education system, I don't think we will ever be able to meet with these kind of epidemics. I'll finish here by saying that whatever little work we have done with the help of other organizations, because we as SAP, we are member of running Joint Action Committee, etc., etc. We are doing little things here and there, and I would like to share through PRIA whatever the 2 studies and whatever we are doing. However, I think this is the time that we think out of the box and think as South Asians and help each other to come up a strategy where we as civil society organizations may not be totally, I mean, I don't mind getting funding from abroad. I mean, as a citizen of the globe, UN has given me a right. However, there are other ways to deal with the situation, and we should go ahead. Thank you very much. I mean, I don't underestimate the knowledge base we have. I don't underestimate the technical information we have and the experts we have in our part of the world. We can beat anybody. Thank you so much.
Thank you, Tahsin. Without taking any more time, we are already 10 minutes behind the schedule. Let me invite Mr. Ichal Supriyadi, who is the Secretary General of Asia Democracy Network.
I was talking when it's mute. So my role is to make a closing remark.
Rachel, I initially I thought it'll be very generous. This is Kostuvia. I thought I'd be able to very generous with 10 minutes for you, but we have to cut short. And maybe if you could sort of tell us, after listening all this conversation, what ADN should be doing. What ADN should be doing.
Well, first I would like to thanks for this forum. I think it is privilege for me and for the ADN to be part of these discussions and learn the South Asian civil society situation during this pandemic. I think this is really value for all of us. And then I believe more activities like this is necessary to be expanded, to be empowered, that includes such other sectors like media, women, disability, and many other sectors that also hit badly by the pandemic. I think we all agree pandemic is attacked the heart of democracies. And then many civil society make inefficient response in providing their function to check and balances toward the government policy. But we are now learned after a couple of months, we are some of us is really really involved in the struggle for containment and life-saving tasks, the supporting governments or helping the societies. And then we've been addressing the vulnerability by providing relief, many civil society involved in that. And then now we start thinking ahead. I think at the outside of the CSO involvement so far, I think first it's very important and very critical for all of us to recognize the CSO is there, was there, is there, and will be there to play a role in the crisis handled. The civil society has been filled the gap or providing actions despite the absence of the governments in the first, let's say, wave of the pandemics, Kaustubh and other friends, other colleagues. But the CS also vulnerables. I think this is the time for us to really thinking the common strategy that need to be built in the local level, in the national, also in the regions. And then, but so many combination that actually we try to consider as the Asia Democracy Network, civil society umbrella in Asia. But then again, first we're going to start with, let's try to build the narrative at this point, because there will be a lot of consolidation among the donors. There will be a lot of the hassle, renegotiation need to be undertaken by all. And then I think I agree with many of the statements that been said by the previous speakers. There's going to be new order. There's a new habits. Things will really change now. Then I think civil society is really facing a lot of struggle in terms of the finances, in terms of the re-strategizing the effort. But I'm going to offer you, at least now, try to repositioning yourself, try to maintain the narrative, and try to tell everyone not to move or not to ever things to consider repressive as the ultimate key handle for this crisis. We have to tell them repression will not help to control the pandemic. Silencing the free speech, jailing peaceful dissenters, suppressing legislative oversight, and then minorities and vulnerable sectors will not be result in anything. The assault to the freedom, transparency, and democracy will make it more difficult for societies to respond quickly and effectively to the crisis. We have to keep telling the peoples, and then our government, and even ourselves, if democracy is not just cherished ideal, it is a system of government that's suited to addressing a crisis of this crisis. And then I think at the moment, every civil society are still in the same stage. And then what I can offer is just invitation for all of us to keep discussing this matter, to keep sharing, to increasing and our intensity in some of communication and dialogues. And of course, we're going to appeal to many kind of for the sustainability of resources, including funding and support that available somewhere there, and then try to make or utilizing this platform or online, as this is the only platform or online still available for us to communicating each other. Sounds like there's not so much promise, but I think this is the realistic things that we can do at the moment. So finally, I have to thanks to Kaustuv for the excellent moderating, for the moderations, and then all the speakers. Some of them are my friends, or maybe not. Last but not least is to Dr. Rajesh Kendall, and then everyone's. Thank you so much.
Thank you so much, Chichel. Thank you. Let me now invite for the final closing remark Dr. Rajesh Kendall, who is the founder president of Participatory Research in Asia, PRIA, but he is also a co-chair, a UNESCO co-chair on community-based participatory research and social responsibilities in higher education. Dr. Kendall, you have heard all the speakers from almost except Maldives, all the countries, and some have referred to particularly PRIA's role as a research organization. So if you expand that role to include that, what kind of research we should be doing. People have also talked about an alternative paradigm, which is based on much more equitable understanding and distribution of resources, which is, in a way, kind of lessening the inequalities. That's the message that many speakers have said. So what will be your final reflection after hearing this? And finally, one more reflection that I want to hear from you is of regional coordination. Tehseen has said very valuable things, but I want to hear from you as well. Dr. Kendall.
Thank you, Costa, and thank you all of you. Great to hear you, look at you, feel your energy. And I'm even more inspired at this time than at 10:15 in the morning. So thank you. First of all, I want to wish all of you World Biodiversity Day. The South Asians today are chatting on World Biodiversity Day. And this year's theme is to live with nature, to live with nature. And we are imagining a new society, which several of you have talked about. Model will not work. Zakir's idea, it can't work. Everybody has talked about it. Nothing new. I don't want to add into that. I want to propose to you, there is a group of us, and Jagdaji and Harsh and others are part of it. Those of us with white hair in civil society in India have taken on a responsibility to facilitate a conversation which will reimagine a future society where we, the people, are at the center. And we, the people, are at the center in locations which are ours, not governmental or corporate or whatever. And that process is on. But after today's conversation, I think this reimagining of we, the people, should be we, the people of this subcontinent. We, the people from Hindu Kush to the Indian Ocean or wherever, all over, we, the people. And I would therefore take the liberty of, as these drafts of conversation emerge, share with all of you and encourage you to have that conversation within your own networks so that we can visualize collectively a world which is where we want to live in. The second point that I picked up from all this is that only the nature of geography and passport is different. Rest is the same. in the region. When we talk about civil society roles, we talk about challenges, we talk about resources, we talk about civic space. It's similar. Almost identical, not even similar, identical. But there are great things happening. And I will send you, I don't want to take much time, but I picked up a key message from each one of you. Migrant Fund Watchdog in Bangladesh. National Platform for Institutional Care in Sri Lanka. High-level Monitoring Coordination Group in Nepal. Citizen Volunteers Networks in Bhutan. Informal outreach and database effort in Pakistan. Citizen Action Group in Odisha. And outreach to rural areas in conflict zones from Afghanistan. These are wonderful examples of what only we could do. And I want to therefore encourage us to talk loudly and vocally about what only we can do. What neither the governments can do, nor the financiers can do, nor the stock markets can do, but only we can do. There are challenges on our borders, and the issue of migrant workers is such that I heard stories about Nepalese migrant workers from Bangalore trying to go back to Nepal and facing problem both in Bangalore en route to Nepal and on the border. And similar things are happening with Bangladesh, and I'm sure happening between Bhutan and Nepal and Pakistan and Afghanistan, and and these challenges are taking. And this is an area where we need to pay attention. But more importantly, I think we need to find a way to produce a bottom-up South Asian perspective. And I would offer to support this process myself as well, with all of you and others who are not in the group at the moment. I invite them. Let us talk about the contributions, the distinctive contributions of citizens and civil society in South Asia as a way of, first of all, acknowledging and applauding ourselves, and then to tell the rest of the society, in particular the government, that this is what we have done. As Harsh mentioned, I am working with Vani and a few others to pull together a report, quick one, by end of this month, and I'll share it with you. But on that basis, let's do that. The third point that I want to make in terms of going forward is the possibility of innovative ideas germinating in different places in the region to become catalysts of new experiments. And we talk about new experiments. I like the idea of the Sindh law and the idea of the platform that Sri Lanka has prepared. These are the ideas that need to be shared. And the reason they are not being shared, it takes a webinar or a pandemic, is because we have lost touch. And the reason we have lost touch is we can't blame anybody else. In our families, if we want to connect with our loved ones, we have to take the initiative. And this is no different. This is no different. If I want to connect with Sadika and Zakir and Ichal and Vinay and Jitram, I can't blame anybody else. I have to do it myself. And I appeal to all of us to re-energize this process in short way, use the new technology, but make and re-energize the connection. Several of us in this platform have been working together for 4 decades. The same cannot be said either by governments or by even corporate sector. It cannot be said. In the region, we have a major challenge of our demographics. We are a youthful region, which is supposed to be our strength, but we are also likely to become, it can become a nightmare as we are currently witnessing. So the outreach to the young people through the process of discovery in this pandemic, asking questions why it is so, why are these experiences happening, why we disconnected from our environment, why we don't value our own indigenous local knowledge that we had, why, and I think there is a shift in our therefore role, working with young people and working to strengthen local leaders. There are many commonalities, and I will be sharing with you some of these thoughts as I go along. But I think we should take advantage of being a youthful region, and therefore, how do we engage with our young people? How do we, and whatever experiments and ideas we are all developing, let's share that. I think we can make an important contribution. The final point is that this is a rich region in our natural resources, in our histories, in our knowledge systems that are derived from one end of the region to another. And let us begin to revalue and reconnect with that. And that process, take the young people along so that they also reconnect. And this is our new role. Our new role is going to be to reconnect our young people to our heritages, to our knowledge systems, to our natural resource base, to the talent and the willingness of our local leaders, local institutions, and local capacities. Thank you.
Thank you so much, Dr. Tendon. I know that we have well past the scheduled time for our webinar. It is almost like 2 hours that we have been talking, but it has been a tremendous privilege to hear all of you, and also the kind of questions and comments that we received from the participants. Thank you to all the panelists, and thank you to all the participants who have enriched this discussion. The intellectual capital and the intellectual richness of the civil society sector in the region is reflected in today's webinar. I'm sure, as Dr. Tendon has said, that there are many best practices, there are many innovative practices coming out of this region, and one of the tasks could be to document those innovations and share it widely so that we can further be more effective. What we will do, first of all, we have documented, recorded this webinar. We'll prepare a report. We'll send it to you and also to other participants who couldn't join. Unfortunately, we have a limitation of accommodating only 100 participants, but we have a wide network available in the region. So I will make sure that the report and the recording of this webinar is disseminated well. But also, as Dr. Tendon and others have emphasized, that some of the critical points coming out of this discussion, particularly which are solution oriented, should also be communicated to the policy makers who matter the most in this pandemic time. So once again, thank you to all of you. It's a wonderful, wonderful discussion.
Thank you. Bye-bye. Bye-bye. Thank you so much. It was wonderful. Thank you.